Hi, my name's Madison Brown. I'm the physician assistant at Center for Neuro Rehab Services. This video is going to serve as our first installment in the CNS Education Series. Today we're going to be talking about the 4 basic health essentials for concussion patients. The first basic healthcare essential we're going to discuss today is hydration. Your brain is made of 70 to 80% water, and thus being dehydrated can really have a big impact on your cognitive functioning. We suggest that you drink 6 to 8 glasses of water each day. You should avoid drinking excessive amounts of caffeinated drinks and alcohol. These include coffee, soda, and tea as well. Avoid drinking excessive liquids before going to bed, as this may be a reason that you are waking up frequently at night. The second basic healthcare essential is nutrition. Your brain runs on oxygen and glucose, so you should eat multiple small meals throughout the day in order to fuel your brain. If you're having a hard time remembering to eat throughout the day, set an alarm on your cell phone to remind you. You should avoid eating high carb, high sugar, and high caffeine snacks. This would include things such as sodas, candy bars, or potato chips. You should snack on high protein foods such as cheese and nuts. The third healthcare essential is exercise. You should get around 30 to 60 minutes of daily exercise to improve the energy efficiency of your brain. Exercise can improve your energy level, it can improve your mood, and it can also help with controlling weight and reducing fatigue. Walking is a great way to start. You could walk around your neighborhood or walk around the track at the gym. Some people even like to walk inside of malls if there's bad weather out. Household chores and yard work are also good forms of exercise. Remember to incorporate stretching and a cool down period after you've exercised. Here are a few safety tips when you begin to exercise. Take your cell phone with you on walks. This is important in case you get lost or you need to call somebody for help. If you have trouble with balance, please avoid using treadmills or overhead free weights, as these things can cause harm if you start to get dizzy or fall. If you experience chest pain, discomfort, breathing problems, and/or wheezing with exercise, stop immediately and let your doctor know. The fourth healthcare essential is sleep. Sleep is a very important part in your recovery from concussion. Sleep can affect cognitive functioning as well as your mood. You may see deficits in attention, concentration, working memory, and processing speed because of sleep deficits. Effects of poor sleep may be even more evident following a concussion or brain injury when you're already suffering from these types of symptoms due to your injury. Remember, your goal following a concussion is to maximize restorative sleep. This means to look for any reasons why you may have difficulty falling asleep, staying asleep, or returning to sleep after you have woken up in the middle of the night. This may also be a reason for your doctor to look and see if you have obstructive sleep apnea or central sleep apnea, as decreased levels of oxygen to your brain throughout the night can hinder your recovery from concussion. Here are a few tips for better sleep. Set a specific bedtime. Establish a pre-bedtime ritual. This should include things that are not stimulating and help to calm you. You may look at journaling, reading a book, taking a bath, or sipping some tea. Avoid engaging in stimulating activities prior to bed. This is anything that jazzes you up or gets you excited. Avoid the use of electronics 30 minutes to an hour prior to bed due to stimulation and blue light exposure. This means you need to put down your cell phone, put down your iPad, and turn the television off when you start your pre-bedtime ritual. Keep your bedroom cool and dark. If you have a hard time sleeping in complete silence, try using a fan or other white noise generator in order to create some noise in the bedroom. This may also help for people who have tinnitus. If you're unable to sleep for 30 minutes, get out of bed, go do an activity that is somewhat calming and not too stimulating, and then return to bed once you get tired. This completes our first CNS education video on basic healthcare essentials. For more information, please contact our office or come in for an evaluation. Thank you.